Hepatitis refers to inflammation of the liver. When the liver is inflamed, its function can be affected. Alcohol consumption, medicine or toxins, some medical conditions, and infection, for example viral infection, can all cause hepatitis. The most common cause of hepatitis is viral hepatitis. Among the viral hepatitis, hepatitis A, hepatitis B, and hepatitis C are the most common viruses which can cause hepatitis. For hepatitis A, a person can get infected if he or she ingests food or drinks contaminated by fecal material from an infected person. So for hepatitis B, a person can get infected through bodily fluid such as blood, semen and other bodily fluid. The most common route of transmission is birth from infected mother, sex with infected person, sharing personal equipment with an infected person such as needles, syringes and toothbrushes or razors. As for hepatitis C, it is usually transmitted through blood or blood product. For example, if a person inject drugs or share needles with an infected person, he or she can get infected. If a person receives a blood or organ transplant before 1992 from an infected person, he or she can also get infected. So many people with hepatitis do not have symptoms, and if a person develops acute hepatitis, they can take 2 weeks to 6 months after exposure to develop symptoms. If a person develops symptoms of hepatitis, they can have symptoms such as fever, lethargy, loss of appetite, nausea and vomiting, dark discoloration of the urine, and also joint pain at times. For acute hepatitis A, usually supportive treatment would be sufficient for the symptom relief. For hepatitis B, usually we follow up the patient to look for signs of progression and also signs of liver cancer. If patient develops progression for chronic hepatitis B, we can give antiviral orally. As for hepatitis C, we can give treatment to patients if they develop chronic hepatitis C, usually orally or with pills, and the cure rate is more than 90% with minimal or little side effects. So in conclusion, I recommend patients who develop signs and symptoms of hepatitis to seek medical treatment as soon as possible. And for those with high risk factors, maybe they can get screening test done and get vaccinated, especially for hepatitis A and hepatitis B infection.